Welcome to the Deep Dive.
Great to be here.
Today, we're really digging into the ongoing situation around Robert F. Kennedy Jr.'s nomination, as President Trump's pick for Secretary of Health and Human Services.
Right. And we've pulled together some key reporting from places like Brookings, Nature, PBS NewsHour, Mother Jones, trying to get a full picture.
Exactly. Our goal here is to kind of unpack the concerns being raised, things about his past statements, his current actions, especially around vaccine policy.
And what that all might mean for public health and, critically, public trust in the U.S. It's a big topic.
It really is. So let's start with the nomination itself. He was nominated by President Trump and actually passed a key Senate hurdle back on February 4th, 2025.
That's right. But the confirmation hearings back in January and then again on September 4th really brought his history of controversial comments back into the spotlight.
Yeah, and we're not just talking sort of general skepticism. The sources point to specific anti-vaccine rhetoric and, well, some really troubling stuff.
Troubling is the word. Things like unscientific remarks about Black people's immune systems.
Can you elaborate on that? I know there was that 2021 interview.
Yes, where he suggested Black people might need a different vaccine schedule because of supposedly stronger immune systems.
Which sounds alarmingly familiar.
It does, unfortunately. It really echoes racist medical tropes that have a very long and damaging history in this country. Think Tuskegee, Henrietta Lacks.
Right, so it's not just scientifically wrong. It taps into this deep vein of historical mistrust.
Precisely. And when someone up for HHS secretary says things like that, it doesn't just, raise eyebrows. It actively undermines trust, especially in communities like the African-American community, where data shows over 40% already report medical discrimination. It sort of weaponizes that existing mistrust.
That context is crucial. It shows why these aren't just abstract comments. And then there's the whole COVID-19 misinformation aspect. He's been called a leading spreader.
Yes, promoting various conspiracy theories. One really stark example from 2023 was the claim that COVID-19 was an ethnically targeted bioweapon.
Designed to spare certain groups, I believe.
That was the claim. It's incredibly dangerous because it plays on real fears about biological warfare and racial targeting. It just eats away at trust in science in institutions.
And didn't fact-checkers also confirm he compared the CDC to Nazi death camps? Though he denied it later.
They did confirm that comparison was made. The denial came later, but, well, the damage to credibility was arguably done. It's so serious that even his own family members...
His sister, Carrie Kennedy, his nephew, Joseph P. Kennedy III.
Exactly. They've publicly called for him to step down, calling him a threat to American health. That's quite a statement from family.
It really is. So, okay, let's pivot to policy. If he is confirmed, what does this mean in practical terms? He'd oversee 13 agencies.
A huge portfolio. And we're already seeing moves. He recently fired all 17 members of ACIP, the Advisory Committee on Immunization Practices.
All of them? Wow.
All of them. And replaced them with 7 new members. And reports suggest some of these new members have publicly expressed anti-vaccine views themselves.
And ACIP is? Well, it's a group that sets the standard vaccine schedules, right? For kids, adults.
That's the one. They literally recommend which vaccines we get and when. And there's actually an ACIP meeting scheduled for next week, September 18th and 19th.
What's on the agenda?
Key vaccines, COVID-19 updates, hepatitis B, and the MMRV, that's measles, mumps, rubella, varicella, core childhood immunizations.
So infectious disease specialists must be concerned.
Very concerned. Especially about potential restrictions on kids' access to vaccines. We already saw the FDA limit the updated COVID vaccine to over 65s or high-risk individuals.
Which the American Academy of Pediatrics called deeply troubling, didn't they? Since they recommended for all kids 6 months and up.
They did. And it's not just COVID. You have anti-vaccine advocates questioning things like the universal hepatitis B shot for newborns.
Despite its success since the 90s in drastically reducing cases.
Despite that massive success, yes. These policy shifts, they're not abstract. They have, as the sources say, real-world implications. We're seeing measles outbreaks, whooping cough, preventable diseases coming back.
And these federal changes are having knock-on effects, creating this phenomenon people are calling vaccine tourism.
Exactly right. The administration rolled back that national access to COVID vaccines for everyone over 6 months. So now it's a state-by-state thing.
A patchwork?
A total patchwork. You get these stories. Someone in Florida with MS driving, 90 minutes to Alabama, paying over $200 out of pocket for a shot they used to get easily.
Or people in Oregon just hopping over the border to Washington.
Just a 20-minute drive sometimes. It really highlights the disparity.
And some states, blue states, are trying to band together, right? Like the
Yeah.
West Coast Health Alliance.
Yeah, they're trying to create regional access, essentially pushing back against the federal pullback. Public health experts are calling the whole situation a tragedy, basically federal negligence.
It really underscores a breakdown in national public health strategy.
Definitely. When access depends on your zip code, it hits vulnerable people hardest and weakens everyone's protection.
So to wrap up, we've seen how this nomination, tied with a deep historical mistrust and these major policy shifts, is really changing the public health landscape.
It's a convergence of factors that's causing a lot of turbulence.
And it leaves us with a pretty stark question, doesn't it? As this established guidance, this scientific consensus faces these fundamental challenges, what are the long-term consequences for society, for individuals, for you listening? What does this path mean for our collective health? Something to think about as this unfolds.